Goeiedag, good day, fellow South Africans and citizens of the world. And the fantasy continues in South Africa. Let me explain to you what I'm talking about. I'm talking about coronavirus confirmed cases of infection. Now, the numbers have officially increased to 1,655, which is an increase of 70 cases on the day before. Now, remember, we're still working under the concept of the old paradigm with testing on the coronavirus. And I can guarantee you that probably 95% of those people that have confirmed positive are in the minority group populations, and most of them will have traveled. Now, that doesn't mean to say that the rest of the population hasn't been infected. It just means the ANC government, because they haven't had enough coronavirus test kits out there, and B, when people do it privately, it costs an arm and a leg to actually get a test done. 95% of the population say, forget it, we're not going to spend that money on a bloody test, so they don't get tested. Now, we heard up to a couple of days ago that public hospitals were turning people away who showed coronavirus symptoms and told them to go to self-isolate without doing a test because they had no testing kits available. You're starting to get the picture. This figure of 1,655 is, in a word, BS. Health Minister Dr. Zweli Mkhize made the announcement on Sunday night through a statement that the total number of confirmed coronavirus or COVID-19 cases in South Africa has risen to 1,655 with 11 confirmed deaths. The increase in confirmed cases was 70, just 70, from the previous reported cases on Saturday. You can understand my reasoning as to why this is a BS figure. Anyway, let's continue. The total number of COVID-19 tests conducted to date were 56,873, which was an increase of 2,936 from those reported on Saturday. Now, let's remember, it takes up to 10 days for someone who's taken the test to get their results. This is not the United States or Australia or one of those first world countries. This is South Africa, which, quite honestly, is rather like Fiji. I'm on Fiji time. No hurry, no worry. That's basically how things work in South Africa. Anyway, getting back to the story. The first deceased patient is an 82-year-old female who was admitted to ICU on the 29th of March 2020. She had presented with fever, short breath, body pains, dry cough, and sore throat. She also had comorbidities that included hypertension, diabetes, and cholesterol, i.e., she had other ailments, which make her chances of being a fatality with the coronavirus that much higher. The second deceased patient is an 86-year-old male admitted to hospital on the 26th of March 2020 with a diagnosis of bronchopneumonia and respiratory distress. He had an underlying condition of chronic obstructive airway disease, Mkhize said. So you can see that ailments are like a pathway to things not going too well. The provincial breakdown of infections, this is the official BS figure in South Africa, is Gauteng 704, Western Cape 454, KwaZulu-Natal 246, Free State 87, Eastern Cape 31, Limpopo 19, Mpumalanga 18, Northwest 11, Northern Cape 8, and unallocated 77. Now, you know what they're actually saying when they say unallocated? They're saying that someone who was actually filling in the documentation didn't fill it in correctly. So there's no way of actually finding that person who's got the coronavirus, and he's now wandering around, doing this stuff, infecting a whole lot of other people. This is why I say in the next, well, I would say in the next 10 days, you're going to see things absolutely go crazy in South Africa. Because it takes a couple of weeks, remember, for this virus to actually start showing symptoms. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please join us tonight at 8 p.m. Johannesburg time. I will be talking to Doreen van Rooyen from the trucking industry, and it's going to be a very, very disturbing conversation about what the truckers are facing right now in South Africa. Please like this video, please share this video, and above all, please stay safe. Bye for now.